Stress testing. You will exercise or be giving medication if you are unable to exercise to make your heart work hard and beat fast while heart tests are done. Angiography, or cardiac heart cath, uses dye and special x-rays to view the inside of your arteries. It will show plaque in your arteries or how severe the blockage is. What is the prognosis for CAD? The outcome of CAD varies per person. A person with any form of CAD has a higher chance of dying when the left ventricle of the heart has been weakened. Previous myocardial infarctions weaken the heart, so a past history of heart attacks worsens a person's prognosis. Depending on the person, CAD can require both short-term and long-term care. A person diagnosed with CAD can still perform activities of daily living without complications.
There are multiple things a patient with CAD can do to reduce the impact of the disease. Lifestyle changes are a big factor. If you were to exercise regularly, maintain a healthy weight, quit smoking, manage stress, and follow up with your doctors as directed, and take your medications. Treatment is available for patients with CAD within all states. Medications for CAD can be found on all the affordable dollar lists as well as over the counter. Some medications can be expensive and patients may require assistance with obtaining medications. Education, marriage, and having children are not affected by CAD. The problem is for coronary artery disease. A couple of nursing diagnoses are ineffective airway clearance related to secretions, decreased cardiac output related to changes in the rate, rhythm, cardiac conduction, and myocardial infarction, impaired tissue perfusion related to decreased blood pressure, excess fluid volume related to decreased organ perfusion, impaired skin integrity, anxiety or fear, activity intolerance related to the imbalance between oxygen supply and demand, knowledge deficit related to the lack of information, self-care deficit related to weakness, and acute pain related to heart tissue ischemia.
Our number one nursing diagnosis for a patient with CAD is ineffective airway clearance related to secretions. In our assessment, we're going to assess the patient's respirations. We want to note the quality, the rate, the depth, flaring of the nostrils, dyspnea, and dyspnea on exertion, and use of accessory muscles. We want to assess any change in mental status, assess the patient for pain, and if the patient is on mechanical ventilation, we need to assess for peak airway pressures and airway resistance. And we also need to assess the patient's knowledge of the actual disease process. In our interventions for ineffective airway clearance related to secretions, we want to assist the patient in performing coughing and deep breathing maneuvers to help cough up the secretions. Educate the patient on splinting techniques as well. One of the main things we learned in nursing school is to turn, cough, and deep breaths. We want to position the patient and instruct the patient on the optimal position when they do become short of breath, which is sitting up. And if coughing is not effective for the patient, they may require suctioning. We want to encourage for them to drink lots of fluid to help break up the secretions, and teach the patients how to use their inhalers as prescribed, and explain the effects of environmental factors that affect breathing, which includes smoking as well as secondhand smoke.
The next nursing diagnosis is decreased cardiac output related to changes in the rate, rhythm, cardiac conduction, and myocardial infarction. The assessment that we would do, we would assess heart rate, blood pressure, skin color and temperature, peripheral pulses, heart sounds, lung sounds, monitor the ECG, assess response to increased activity, and assess for chest pain. Interventions that we would do for decreased cardiac output would be to maintain adequate ventilation and perfusion. For example, placing the patient in semifallers to reduce preload and ventricle filling and put the patient on humidified oxygen. Maintain physical and emotional rest. Administer prescribed medications as directed and monitor the effect. It is important to explain the drug regimen to purpose, dose, and side effects. explain progressive activity schedule and overexertion, and also explain diet restrictions.
A third nursing diagnosis would be impaired tissue perfusion related to decreased blood pressure. And in our assessment, we would want to assess mental status, assess the blood pressure, assess peripheral pulses. The extremities should be warm with the absence of pallor or cyanosis. Capillary refill should be less than 3 seconds. Absence of edema, and urine output should be at least 30 mL an hour. And our interventions with impaired tissue perfusion are maintain IV access for IV fluid administration, administer vasopressors if needed to maintain adequate blood pressure. Some examples are dopamine or norepinephrine. Monitor for decreased blood pressure, restlessness, confusion, cool extremities, edema, or oliguria. And notify the physician if signs and symptoms worsen or persist.
Another nursing diagnosis is excess fluid volume related to decreased oxygen perfusion. In the assessment, you would monitor weight daily with the same scale and preferably at the same time. Monitor for a significant weight gain. That would be like 2 pounds in 1 day. Record daily intake and output. Assess lung sounds for crackles, change in respiratory pattern, shortness of breath, or orthopnea. Assess for edema. Monitor and document vital signs. And then monitor serum electrolytes, urine osmolality, and urine-specific gravity. Interventions for this would be instruct fluid restrictions, administer and direct the patient to take diuretics as prescribed, elevate edematous extremities, instruct the need for anti-embolic stockings to promote venous return and limit fluid accumulation in the extremities, provide adequate activity and positioning, identify and teach the signs and symptoms of fluid volume excess to the patient and family, and explain the importance of maintaining proper nutrition and hydration and diet modifications.
Our last nursing diagnosis that we have is impaired skin integrity, and just like every other disease, when you're in the hospital, when you're laying in a hospital bed for long amounts of time, you're going to be at risk for having impaired skin integrity. So we want to assess all of our patients that we're taking care of to make sure that the skin is intact, the whole body, but we want to focus on bony prominences, which is where people are most likely going to get skin tears. You want to assess the patient's ability to move, because the less they move, the more at risk they are. Assess their nutritional status, their weight loss, and their albumin levels. Assess for any urinary or fecal incontinence, because you don't want them laying in it for long periods of time. Reassess the skin often, because the skin integrity can change very quickly. And you want to assess the amount of shear and friction on the patient's skin when they're lying in bed. Our interventions are to implement a turn schedule. Usually every 2 hours is when you want to go in and turn your patient. Encourage functional body alignment. Encourage the implementation of pressure relieving devices, even something as simple as placing a pillow under their heels. Limit chair sitting to 2 hours. You don't want them sitting on their sacral area for long periods of time. Encourage ambulation. You want to clean and dry and moisturize the skin, especially over the bony prominences, twice daily or as indicated due to incontinence or sweating. And you will also want to encourage adequate nutrition and hydration, which is 2,000 to 3,000 calories a day and 2,000 milliliters per day, unless they're medically restricted from fluids. And you want to teach the patient and the caregiver the cause of impaired skin integrity, such as pressure on the skin, shearing forces, incontinence, and poor nutrition. A lot of families don't understand the importance of skin integrity, and they don't realize that letting their family members lay in the same position over and over every day can cause them to become very sick with skin tears and pressure ulcers. So education is the main key for the patient and for their family. We also have some pictures in our slideshow that we have provided that explain and show the pathophysiology of CAD. and it also has a couple of clinical manifestations for it as well as management for it, such as stents and sometimes even as far as bypass surgery. Then here is also another picture showing what a normal artery looks like and what an artery that has blockage looks like.